We have our 22 total positive cases, the 4 resolved and the 18 that are moving forward. We have our 2 new cases in there, and that was a 50-odd-year-old person from Iran travel, and that person is at home in isolation. And then we have another one, which was a new one for us, and you heard the press release this morning from Waterloo, with a traveler from northern Italy, who came back on the 3rd, was already symptomatic on the flight, tried to use precautions in that, and so they're following up on that with the flight mandate, etc. That person is also at home on isolation, but when they were there, they were seen quickly the next day with proper PPE and everything, so the hospital staff were not exposed in any regards in that effect. With what's going on in Italy, I would be expecting some more, so that's not surprising. I think it was why I haven't seen one sooner. It was interesting to hear that, and that other areas around Ontario are not just Toronto, have many people and groups that travel back and forth to these areas, and of course that's why the travel advisories are in there, to take those precautions, especially in those high-risk centers. We've had now our 4th case resolved. That was in the order there was the young person who had been to back in the past to Wuhan, where they had a questionable test when they came back here. So that was probably already resolving as it was. So as a result, all our cases related to China and Wuhan have now resolved. And we haven't had any new cases for a while, which I think mirrors the effects of what's going on. And it's important to look at that, because as these countries go through these phases with their containment, ability to contain or not contain, and as it goes through with spread through the community, you start to get more and more immunity in the wider population, and you see the epidemic curve comes back down again. We want to watch to see if there's any secondary waves, especially in China, and that in there aspects people talk about repeat infections. If you see that, instead of seeing the normal bell curve, it starts to look like a rippling effect out, and we're not seeing that yet. So again, we're learning from the Chinese experience there, and with the WHO going along looking at their data.